This final research presentation is over cannabinoids, agitation, aggression, and Alzheimer's. Alzheimer's disease is a global epidemic. To date, approximately 50 million people worldwide have been diagnosed with the disease, which costs an estimated $1 trillion annually. According to the Alzheimer's website, there's a new diagnosis every 3 seconds. Every 65 seconds, there's a new diagnosis of Alzheimer's in the United States, adding to the 6 million Americans currently living with the disease, which is the 6th leading cause of death in the country. Studies indicate that 80 to 90% of people with the disease exhibit behavioral and personality changes that are considered to be very challenging and distressing, not only for the patient, but for the caregivers. 30 to 55% of patients exhibit verbal and physical aggressive behaviors. The incidence of the behaviors increases with the progression of the disease. Most of the time, agitation and aggression happen for a reason. These people could be experiencing pain or depression or stress, could be caused from too little rest or sleep, a sudden change in a well-known place, routine, or a person, a feeling of loss, something like no longer being able to have the freedom to drive or go places alone, too much noise or confusion or too many people in the room, being pushed by others to do something like taking a bath or to remember events or people. They may feel lonely because they have less contact with other people as well. And sometimes aggression and agitation may even be an interaction of medications. Behavior disturbances are a major source of caregiver burden and an important contributor to the decision to admit patients to institutionalized long-term care. In the US, 16.1 million caregivers collectively provide more than 18 billion hours of unpaid care that's valued at around $277 billion each year. Many find it necessary to give up their full-time job, and if they don't, providing care effectively becomes a second full-time job that comes with no salary, no benefits, and generally no time off. Aggression and agitation behaviors are not only difficult for the patient, but as stated before, they're a major source of caregiver burden. The caregiver and the patient experience emotional stress, financial stress, and physical difficulties. Many care providers experience health issues due to the level of stress brought on by the many responsibilities. In addition to taking care of their own family, a caregiver's daily routine may consist of administering and tracking medication, transportation to appointments, shopping, cooking, cleaning, managing finances, hygiene, feeding, making legal decisions, and many more. It's easy to understand why there's a lot of caregiver burnout, especially in the later stages of the disease when patients start to not remember their loved ones. It can be a very emotionally intense time for everyone. All of these issues lead to an increased morbidity and mortality and are also a large contributor to premature institutionalization. Although no medication has yet achieved an FDA indication as a primary treatment for behavioral disturbances associated with major neurocognitive disorders, some Alzheimer's patients are given antipsychotic drugs, sedatives, anxiety drugs, or they may even be physically restrained due to uncontrollable aggressive behaviors. If a safe treatment alternative can be identified, it could lead to an improved quality of life for the patient and the caregiver by alleviating some of the stress and anxiety. It could also reduce the cost of care and loss of wages and reduce the amount of premature institutionalization. Previous studies have been conducted utilizing synthetic cannabinoids and have shown promising results. However, they've been limited by small sample sizes, short trial durations, and lack of placebo control. The purpose of this study is to determine if cannabinoids will help alleviate the symptoms of agitation and aggression in patients with Alzheimer's. Subjects should be at least 60 years of age, diagnosed with Alzheimer's within the previous 12 months, and have displayed aggressive or agitation type behavior in at least one time per week over the prior 4 weeks. Patients will be recruited through entities such as the Veterans Administration, their primary care or geriatric clinics, and through public advertising with a recruitment of approximately 50 patients. The decision maker would provide informed consent for the double-blind placebo-controlled study. Initial evaluation for selection would be through an interview with a caretaker who provides at least 8 hours of care per day, 4 days per week. Their degree of cognitive impairment would be assessed using the Dementia Rating Scale 2 at baseline and again at post-treatment. This scale is designed to measure and track mental status in adults ages 56 to 105 with cognitive impairment. It takes 15 to 30 minutes to administer by an experienced neuroclinical psychologist and uses 5 subscales that include attention, initiation, perseveration, construction, conceptualization, and memory. Aggression would be measured using the Cohen-Mansfield Agitation Inventory at baseline and weekly for the first 6 weeks, then monthly for the duration of the study. Measures would be recorded by their primary caretaker. Ratings of physically aggressive, physically non-aggressive, and verbally agitated behaviors will be assessed using the 7-point Likert scale that rates frequency of behaviors and a 5-point Likert scale that rates disruptiveness. A clear definition of aggression is stated as spitting, cursing or verbal aggression, hitting, kicking, grabbing people or things inappropriately, pushing, throwing things, biting, scratching, hurting themselves or other people, tearing things, destroying property, making inappropriate verbal sexual advances, or making inappropriate physical sexual advances or exposing genitals. Patients would be divided into 2 groups of 25. One group would have 0.5 milligrams of cannabinoids, specifically Navalone, administered once daily at a predetermined time. The second group would have a placebo administered in the same fashion. After the first week, dosage would be increased to twice daily for both groups, and at the end of the 12-month study, all recorded data would be compared to determine treatment effectiveness. Also, any side effects, deaths, admittance to an institution, and any incidental findings would be recorded. It's expected that cannabinoids, specifically Navalone, will alleviate symptoms of aggression and agitation in most patients when administered in conjunction with their Alzheimer's medications. This study could provide a safe alternative treatment for the symptoms of aggression and agitation in Alzheimer's patients. It could also help provide a better quality of life for patients and their caregivers by reducing aggressive and agitation behaviors, expenses, reducing loss of wages, stress, anxiety, and depression, reducing mortality rates, reducing physical restraints, and reducing premature institutionalization and incidents of injury to the patient or to others. This concludes my final presentation on the use of cannabinoids to alleviate symptoms of agitation and aggression in Alzheimer's patients. Thank you.